Welcome to our channel, a dedicated source of in-depth knowledge about health and well-being. Today, we invite you to embark on a profound and comprehensive exploration of pulmonary hypertension, a condition that often remains veiled in obscurity, underestimated, and frequently eludes proper recognition. Picture for a moment the relentless struggle for breath, a heart engaged in a ceaseless battle against an unseen adversary. Such is the daily reality for those living with pulmonary hypertension. In this video, we're committed to delving into the intricate tapestry of this condition, offering insights that have the potential to transform lives. Brace yourself for a narrative that will leave you breathless, but in the most profound and enlightening way. To fully grasp the scope of pulmonary hypertension, let's embark on a meticulous journey from its origins. Pulmonary hypertension is a rare yet life-altering cardiovascular disorder, one that intricately disrupts the natural flow of blood through the pulmonary arteries. These vital conduits, entrusted with the monumental task of transporting blood from the heart to the lungs, undergo a profound transformation. They become narrower and stiffer, resulting in a surge of pressure within the lungs. But what catalyzes this condition? Its causes are multi-layered, ranging from idiopathic origins to genetic predispositions and associations with various underlying diseases, including connective tissue disorders, congenital heart conditions, and exposure to specific medications or toxins. We'll descend into the labyrinth of causative factors, delineating how these changes impact the body, the intricate web of risk factors, and the unequivocal importance of early diagnosis in navigating this complex health challenge. Most important is to recognize the symptoms. Dizziness, fainting, and a rapid heartbeat can occur due to reduced blood flow to the brain. As the condition progresses, a bluish discoloration of the lips and skin, cyanosis, may develop, indicating severe oxygen deprivation. Swelling in the legs and ankles, weakness, rapid breathing, and irregular heart rhythms, arrhythmias, are additional symptoms. The severity and combination of symptoms can vary among individuals. Early diagnosis and proper management are essential to enhance the quality of life and prevent complications. Those who grapple with this condition experience a relentless fatigue that transcends mere tiredness. It significantly impairs their ability to perform even the most routine daily tasks, like ascending a single flight of stairs. This profound exhaustion arises from the heart's perpetual struggle to push blood through narrowed pulmonary arteries. And here lies the conundrum. The simple notion of breathing deeper is insufficient. Breathing difficulties do not stem from lung limitations, but are a direct consequence of the elevated pressure within the lungs. Left untreated, this condition can progress to heart failure, elevating its potential threat to life itself. What's even more baffling is that pulmonary hypertension often remains unnoticed or is misdiagnosed, leaving individuals in an exceedingly precarious position. However, the story does not conclude in despair. A multitude of treatment options stand as rays of hope, designed to manage the symptoms and elevate the quality of life for those affected. Medications, including vasodilators and blood thinners, endeavor to alleviate the heart's workload and improve blood flow. Concurrently, lifestyle adjustments, such as adopting a low-sodium diet, engaging in regular exercise, and in select cases, utilizing oxygen therapy, play a pivotal role in enhancing one's quality of life. Pulmonary hypertension is a silent invader, transcending age, background, and walks of life. Yet it frequently precipitates a solitary journey, where individuals often grapple with a profound sense of isolation and misunderstanding. The psychological and emotional toll of living with pulmonary hypertension is nothing short of profound, often resulting in anxiety, depression, and an unsettling feeling of detachment from a world that takes breathing for granted. In this section, we'll introduce you to the real-life heroes who have confronted this condition, displaying remarkable resilience and strength. Their stories are nothing short of awe-inspiring, offering poignant glimpses into the indomitable human spirit in the face of adversity. While the journey through pulmonary hypertension is undeniably challenging, it's by no means insurmountable. Advancements in research, treatment, and awareness serve as beacons of hope for those affected by this condition. The unwavering dedication of medical professionals and researchers has led to a deeper understanding of the disease, yielding more effective treatment options. Innovative therapies, including lung transplantation and targeted medications, offer new horizons for patients. Whether it's extending support to organizations that raise awareness, actively participating in clinical trials, or simply offering a compassionate hand to those in need, together we can breathe life into the battle against pulmonary hypertension, infusing it with hope and transformation. Thank you for accompanying us on this profoundly comprehensive journey through the world of pulmonary hypertension. If you found this video to be a source of invaluable information and an immersive narrative, we kindly urge you to show your support by hitting the like button and subscribing to our channel. Your support is instrumental in raising awareness about this often overlooked condition and in reaching more individuals who may be silently grappling with pulmonary hypertension. Remember, knowledge is power, and by working together, we have the capacity to make a profound impact. So don't forget to hit that like button, subscribe, and stay tuned for more immersive content that empowers you to lead a healthier, happier life. Until next time, take care and keep those lungs breathing freely.